We're live now here. So we'll have, I think we're 1 minute early, but that's fine.
Okay. Can you find me today? On the Facebook?
I'm going to get it on your Facebook page now. But we're live on Facebook.
All right.
Hi. Somebody's there. Is your Facebook page Femi?
Femi Ogunremi.
I can't find you, so anyway.
It happened the other day. But yeah, that's why I was asking whether you found. The other time you couldn't find me either.
I can't find you. I'm going to send it on to your messenger then.
Okay, if you send it, can I share it myself?
Then you can share it, yeah.
Okay, send it to my messenger. I don't know how you have my messenger and you don't have my. Through the messenger, you can look at my profile.
Yeah, but it wouldn't let me
share. I don't know why. Okay, so if I have it on the messenger, I shall.
Be honest, I can't even find your messenger. Hi. Morning, guys, as you join, good morning. We're trying to do some technical stuff here. Okay, I've seen you. All right, let me do that. I have to copy and then paste then. Hi, Juliet. Welcome. Good morning. We're trying here to set up just a minute, then we start. Dr. Femi is there now on your messenger. You can share it now.
Okay.
Good morning. As you join, invite others. And then paste them. Hi, Juliet. Welcome. Good morning. Good morning. As you join, invite others. Have you got it on your page now?
I think I've done. I've shared it.
Okay, good. Okay. Hi, Juliet. Welcome. Good morning.
I'm not sure if it's live there because it's not coming to me as live, but check.
Hi, Blessing. Good morning. Morning, Blessing. So, yeah, we're ready to start. I'm just going to put that on so I can see. My sister, Aritz Ernest, you're welcome to the program. Please help me share the video so we can start. We came on a little bit early. Good morning. How was your week, guys? Today is a beautiful day, and we have Dr. Femi back again in the house, and we're always glad to have him. Most times when it comes to male issues, it's good to have a male talking to men. So I think they connect better when it's the male talking to them, so they connect better. Today's topic is not just really about the male. I think all of us need to learn it. All of us need to know about the prostate. And because if you're a wife or a sister or an auntie, there are some things that they'll be telling you on the phone or even at face-to-face. And if you had an idea, if you had an idea about what we are going to talk about, you'll be able to advise your relative better, your father, your mother, your father, your uncle, your brother. So this topic is not just to men is across to everybody. We all need to know. We all need to understand what the prostate is. And I always have my brother here in the house. He's a very busy person, but anytime that we call on him, he's always ready to. I don't know if he's had up to 4 hours sleep today, but he's here to talk to us, and I really appreciate it. You know, when you have this type of a bond brothers that you can call you can call on any time, and they say, don't worry, I'll be there even when they are tired. So he is one of them. I really appreciate you, Dr. Femi. Thank you for coming.
You're welcome. Thank you.
So the topic is the man and his prostate. And I'll just give a brief history why I like us to be talking about prostate all the time. A lot of men in Africa have died of prostate cancer, and before leading to their death, even when they died, they didn't know what caused the death. A lot of our men are suffering with symptoms that they hide because they feel that's private, and before they talk about it, it's already too late. A lot of our men are suffering with maybe low back pain, and they just think it's normal, and before you know it, they're late and they die. So prostate in a man is very important. It's important to know the functions, what the prostate is, and what are the diseases associated with it. So I'm not going to talk much. I'll allow Dr. Femi to tell us all that he has to tell us today about the prostate. So I'll just go on doing the background managerial work while Dr. Femi takes on the stage. Thank you very much, Dr. Femi Ogunremi. Thank you for coming.
You're welcome. Thank you so much, Idee. And it's always a pleasure to come back. Now, so the topic today is
your volume. Get your volume up a little bit more.
Okay, can you hear me now? Can you hear me? Okay. So can you hear that? Or are you having problem with it?
I can hear. I think it's just a bit faint.
Right. Or maybe because I'm not using my headphone and I can't find it.
No, it's fine. If you can speak louder, it was fine.
Okay, so I will try and talk louder. Can you hear this now? Is it louder now?
Yeah.
Okay, fine. So today I'll be talking about the prostate. And prostate is an organ which is obviously found in men. I want to look for easy way to explain this. You know, if we look at the bladder, the bladder is where the urine is collected, and then we pee through the urethra. So in men, when we look at the anatomy, we'll find, you know, you have the bladder that then ends up into a narrow tube that goes through the penis to the, you know, for us to have where people pass urine. So the prostate is a small organ that is just sitting at the neck of the bladder. So the name prostate is from a Greek word, which means the one that is before, the one in front, leading and guiding. So it's standing there for a purpose. Okay. Now, one of the purpose is to protect, you know, semen when during the process of, you know, ejaculation. It sort of protects the semen. It keeps, you know, it produces some fluids, which, you know, sort of make sure that the genetic components of the reproductive, you know, cells from men, that they're protected, and also give a safe environment for the semen to actually go through for fertilization purposes. Yeah, so thank you for that. So that's a picture that we can see there. You can see the bladder is a round thing. The red or pinkish color thing that we're seeing there is the prostate gland itself. So it's sitting on the neck. You can see the bladder. There's supposed to be a narrow way by which, you know, the urine from the bladder just goes straight into the urethra to be peed out. So that's it. And the sign.
What happened to you now? Oh, I think we've lost him. I don't know. Let me try and get him back. One minute, guys. Let me try and get him back. I don't know if it's his network. I don't know what's happening to him, but I'll try and get him back. All right. He will come back in a minute. So I think there's a problem with his network or something. He'll come back in a minute because we need to talk about the prostate. But if he doesn't come back, I'll still talk about it. But I know he'll come back to talk about it. The prostate is, as he said, the size of a walnut. A walnut is like in our African continent, we call it kola nuts, like the size of a kola nut, a good sized kola nut. That size, that's the prostate. That's the size of the prostate, and it sits just below the bladder, in between the. Oh, okay, it's here. 1 second. Are you coming back? Okay, just click the link and come back in. Okay. Right, he's coming back in. I think he had a problem with his lights. So we're talking about the prostate, and I was going to show you the picture before he comes in. That's the prostate gland. That's the prostate. That's the male organ, and that's the prostate just sitting there. Sitting there on below the bladder. Below the bladder, the prostate is sitting there, and it's sitting. There's a tube-like thing you can see that connects the bladder to the penis. So there is a prostate that sits there between the bladder and that tube that connects to the penis. That tube connects, that takes urine from the bladder to the penis, but the prostate sits just at the neck of the bladder, and that's where it's sitting, and it's doing its job. So Dr. Femi is just coming back in. So we'll wait a minute and see if he'll come. Yeah, he's back in. Right. Welcome back.
Yeah, that's just the Nigerian factor. So the power outage, and then we just put the generator on. So I think I was about talking about the size of the the prostate. It's about the walnut size. So it sits there. It's a chunk of tissue just at the neck of the bladder. So we talked about the function. Now, with this particular organ, it's interesting because as we grow, the size increases as well. It gets bigger and bigger with age. It normally will cause no problem. It sits there, does it function well, but when the size becomes so big, then there can be some troubles. And this trouble is one thing that I think we need to find a way understanding, especially men. And of course, the ladies need to know. I know men, we hide things, we don't say things to our ladies, but it's very important when we share these things. And when we have symptoms that looks like there's trouble around that area, so that we can kickstart and do things soon before it's late. A lot of people are worried about the prostates. People talk about various things that can happen, especially the prostate cancer. Now, let's start with the symptoms that happens when you have the size, a big prostate. So when somebody has a big prostate or enlarged prostates, because of the position of the prostate, that creates some uncomfortable situation. Such we include things like when you want to pass urine, you have problems. I mean, it could be like you have poor stream. You know, the stream of the urine becomes very poor. You can't. You find it difficult to actually. It's like weak pressure of urine. You know, it starts like that. Then it can be a kind of hesitancy that you feel like you want to go, but you have to wait a little bit before the urine then starts coming. And sometimes there will be issues around you've passed urine, and after you finish passing urine, you have a bit of urine dribble again. So there's a kind of dribbling that can happen. And for some people, they have frequency. Frequency means that they just want to go all the time because there's an irritation around that area all the time. They want to go, and they get there, there's nothing. And then again, they want to go, or they go, they do small amounts, then they come back again. And then there could be things like you want to go and then you must go now. If you don't go now, you're going to pee yourself. So you feel the urge to go immediately. So these are just because of the size of the tissue itself, sitting there, either irritating, the area where the urine, comes out from, or also because of the blockage, there could be a kind of backflow where you have the urine retaining back in the bladder. And this, urine that is retained back makes you feel that, even if you open when you expel the urine from your bladder, you still feel there's something there, and then you still want to go. So all these symptoms are linked to this. There are various conditions that can be associated with the prostate, tissue itself. So the simple enlargement happens as we grow in age. We can't help that. However, there could be a situation where this enlargement then cause problem, like I said earlier on. So one of the condition is what they call benign prostatic enlargement, where you have a chunky prostate, which is not cancerous, like you can see in this picture here. So you have a normal prostate, it's quite small. Then you have a big one, which is quite big and chunky, and is standing just at the neck of the bladder, and it's kind of squeezing that neck and causing all the problems or symptoms that we talked about earlier on. Benign prostatic enlargement is not cancerous, and it doesn't sort of predispose an individual to cancer of the prostate. However, it can be very uncomfortable. A lot of the time, it requires no treatment, and it's just something that the symptoms is manageable. It might be simple, small irritation, and it doesn't cause any problem. And when the symptoms get uncomfortable and is affecting an individual, of course, you need to see your doctor. Your doctor will have to examine. Some of the examinations is still one of those things that we use to diagnose that it is benign prostatic enlargement or is something else. So one of the things that your doctor might want to do when you see them and you make all this complaint is to examine you from the back passage. So they will examine from the back passage using the finger.
Back passage, anus. Examine you from the anus.
Yes. So from the anus. So the doctor will examine using his finger to just check. And what he's looking for is to look for the size of the prostate. And then you also want to feel whether the prostate itself is smooth, the tissue, whether it's smooth or whether it's hard or craggy, which is very hard and things. This can be a sign that will say, okay, maybe there's something more than it being benign. So and then sometimes you might want to do a urine test because these symptoms that I said earlier on could just be a sign of an infection. It could be just water infection that you've got, like urine infection, or it might be a prostate enlargement that is not cancerous. Now, I will examine you. There might be, depending on what you agree with your doctor, these symptoms, if it's so bad, can be relieved either by some simple medications. There are some medications that can be given to you to sort of either shrink the size of the prostate, or to relieve your symptoms so that you can pee well. And before that treatment is initiated, obviously, test has to be done to make sure they're not something more than just ordinary enlargement. Like I said earlier on, it could be water infection. Also, it could be diabetes. It could be, even the prostate itself might just be a small infection in the prostate that is causing that. And the other thing that could be an issue there is whether it's a prostate cancer. That will lead me on to talking about prostate cancer. Now, this is a tricky one. In England, for instance, this is one of the highest, occurring cancer in men. Quite a number of people, I think 1 in 8 of men in their lifetime, that I'm talking about the British now, I don't have the record for what happens in Nigeria or in Africa, but 1 out of every 8 men in that part of the world will develop, prostate cancer. However, there are different types of prostate cancer, and I will talk a little bit about that. The interesting thing is the prostate enlargement, the benign prostatic enlargement, and even prostate cancer is commoner in people with, dark ethnicity, like, in African, Afro-Caribbeans, compared to that. So
sorry, one
if we're
second. I will answer we will answer these questions, please, so that we don't stop the flow of the talk. I've noted your questions, Semilore, and we will answer it when he's finished. Thank you.
Okay, so if we have 1 in 8 of men in that part of the world, it means that it will be lesser, around this region. So now the question will be, what are the symptoms of prostate cancer? Because that's what the question will be. The symptoms is not really far from what we have in benign prostatic enlargement. Like I said earlier on, you might have poor stream, you might have, hesitancy, dribbling of urine. There could be frequency of urination, could be urgency, there could be poor emptying of your bladder. In some cases, because the prostate cancer obviously happens within the tissue of the prostate, the cells start multiplying and then replicate and cause a lot of chaos around that area. The prostate produces an enzyme, which is called the PSA, prostate-specific antigen. This enzyme increases as the size of the prostate increases as well. And it also will increase when you have the tissue producing a lot of it. Because that's what happens in cancer formation. You have the cells multiplying, and then they keep multiplying. If the cells multiplying also produce, this hormone, it means that a lot of the hormone will be liberated or released into the blood. So it might be a way to gauge it, but we'll talk about the pros and cons of PSA in a minute. Okay. Now, one other thing that can happen in addition to the symptoms that I listed earlier on is in people that are developing, prostate cancer. Some people will pass urine and they will pass blood in the urine. So, and then they can have pain around the pelvic area. When a man starts having pain around that area, it's good to just take a good look at it again. See your doctor. Let them have a look and be sure that it's nothing sinister. It's not just ordinary, I've got small pain there. Let's keep taking painkillers. If you have pain that is lasting up to like a month, it's going to be 6 weeks. Don't delay. Make sure you see your own doctor. Let them have a look. Let them look at the whole situation. And sometimes they might want to do more tests, which include maybe things like prostate antigen. So then you ask the question, what are the causes of prostate cancer? I think the last time I came and I had a bit of a discussion about this, I said, nobody knows what causes cancer, but we can talk about associated factors. Like I said earlier on, as we grow older, obviously, the risk of cancer increases, and prostate cancer is not out of it. People that have family, a relative, age less than 60, that have developed prostate cancer, they also have a higher risk of developing prostate cancer. There are specific familiar genes that links breast cancer to prostate cancer. So some people whose immediate family has breast cancer might also have a higher risk of developing prostate cancer. It's been linked to diet. We talked about fatty diets. There's also linked to prostatic cancer. Exposure to some metal is a risk factor, and like I said earlier on, ethnicity. So the black are more predisposed to prostate cancer compared to the Caucasians. So how do we diagnose this? The first thing is to be aware yourself. Like the symptoms we talked about earlier on. If you have such symptoms, always see your doctor. Your urine, you're having poor stream. You're now having urgency. Urgency to go to the toilet, to wee, or frequency. When you pee, you still feel like you've not completely peed from your bladder. If you pee blood, don't wait. Back pain, don't wait. So all these things, when you get all these things, you quickly get to the doctors. The doctors can then do more examination. One of it is, like I said earlier, it will do a rectal examination. It's not very convenient, but it's very important to do this. And after that's been done, other things that we might then want to do is to do, the PSA. Now, let me talk about the PSA here, the prostate-specific antigen, because a lot of patients will come and say, "Oh, I want to be screened for prostate cancer." Now, you need to have information. You need to be informed to be able to actually take a decision here. I will explain this, and you have to be patient to understand this very well, because there will be a lot of facts that I will be rolling out, and then you need to link all these facts together for you to be able to actually take decision. Prostate-specific antigen is produced in the prostate tissue. Okay, so these prostate cells produce it, and is in the blood. The level increases, it rises as we go. So based on the age, we can titrate the level that is expected. Okay. Now, when there's prostate cancer, there are different types of prostate cancer depending on the tissue. Because when we look at the anatomy of the tissue of the prostate itself, there are different areas. There's the center part, there's the one on the side, and there are different cells there. And these cells will do different things. So when you have a cancer that is located in a particular part of the prostate tissue, the cancer might start growing, and the level of the PSA might not rise. So what I'm trying to say is, there are a lot of people that will have prostate cancer that even if you do PSA, the level will be normal. In fact, a lot of men have been diagnosed with prostate cancer at the time of postmortem, which means that maybe they die of road traffic accident, or they die of some maybe heart attack, and then they want to do a biopsy, autopsy. So when you do an autopsy, you do all the tissue, and then you take the prostate, you open it up and then you find out, oh, they've got prostate cancer, but that's not what killed them. Okay, so they have the cancer, they've had it all their life, or whenever they have it, we don't know, but they die of something else. Then we're doing autopsy, then we find that they have cancer. Does that make sense? Now, the other thing that can happen is you can do prostate-specific antigen on men. And when you do the prostate-specific antigen, you discover that it is negative. The level is low, is within normal. But this person still has prostate cancer. Okay? Now, because people say, I want to have it done. I really want to have it done. If we have the prostate-specific antigen done and it's positive, we have to go ahead and action that. You can't say, oh, you've got prostate-specific antigen that is raised. Don't worry, just go home. It will be fine. Okay? Once it's raised, what your doctor will do, depending on the level, a very high level of it, the doctor might say you repeat it, or the doctor might say, okay, this is too high, you need to see a urologist. And then you go and see a urologist, and then they will have to do more tests. They will have to do maybe an MRI. They might have to do a biopsy of the prostate, which is done by introducing a small, probe through the anus, and then they take sample in various parts of the prostate, and then they take it to the laboratory and look at it whether there's cancerous cells there. So if they then do this biopsy and the histology comes back and it said it's cancerous, nobody will say don't treat it. We then say, okay, you have to have treatments. We'll discuss treatment with you. And then with the treatments, it's going to be, some medicines that, they can be toxic sometimes. And then that in itself could be a cause of problem, because you start treating, then, it could come up with another problem on its own during the course of treatment, because of the side effect of the medication or the effect of the medication on the body and things like that. And unfortunately, in some cases, that could actually kill some people sooner than the cancer itself will do. So it is very, very easy. And then there's a lot of controversy amongst the specialists on this, whether we should do a general screen, that people go out and then do PSA on everybody. It's whether we overdiagnose this and then we treat people and the treatment cause problem, whether a lot of these people that we're treating, whether they have the cancer and nothing happens. So the bottom line is still not very, very clear. There's still a lot of research going on in this area. Unlike when you're talking about breasts, or you're looking at cervix, or you're looking at other tissue or bowel cancer, where you have things that you say, okay, do this, do that. For screening, to screen for prostate cancer at the moment is still a lot of controversy around it. They're going to the community and say, okay, let's do this screening for prostate cancer. Because a lot of people ask me when I go about, we want it done. I was doing a program last weekend, and a lot of men turned up and they want to do prostate. I said, fine, you can do it. But what we need to do is you need to understand it's going to be your own decision, whether you really want to. I haven't understand all these facts, whether you still want to go ahead. The facts are prostate specific antigen is not very, very specific. You might have a high prostate specific antigen and you don't have cancer. There are other things that can make it high. If you have, if you just ejaculated, the level is going to be high. For example, people, if you have sex within 48 hours, the level goes up. If you had prostate examination in the past 48 hours, the level goes up. If you had a biopsy of the prostate, or you have, massage of the prostate or things like that, within the period of time, the level goes up. And if you have infection like the prostatitis, the level goes up. So there are a lot of things that will cause the level to be high, which are not cancer. So if the level is high, doesn't mean that you have cancer. Now, if the level is low, does not mean that you do not have cancer. So in the end, say, what do we do? A big question. So we always, what I would always advise is, rather than saying we do everybody, because they haven't gotten any symptoms, we just do everybody. I think we need to be vigilant. Once we start having symptoms, any symptoms that I listed earlier on, is the best time to go to the doctors. Then the doctors can then do this test. Then it's still fair that you say, okay, you've got the symptoms, and then you're having the test done, because chances are there, even the small chance, but the chances are there that you might have it. And then in that case, things are, sorry.
Okay, Dr. Femi, let me just ask the one of the men I've asked, what is the age of that you begin to have symptoms of prostate problems like prostatitis or BPH, which is benign prostatic hypertrophy, or symptoms of prostate cancer? What is the age? And before you answer, I just want to bring up this picture again, and I see if I can really bring it close to the screen to show you. There is a tube that connects the bladder to your penis, and that's the urethra, and the prostate sits on it. And because when that prostate gets any problem, that is the reason you have the urinary problems. of dysuria, going frequency, whatever that bladder is doing. Sometimes the bladder is just fibrillating, vibrating because of all the things happening around the prostate. We have obstruction. You are unable to pass urine at all because that prostate is enlarged and is squeezing on that little tube that connects the bladder, which carries your urine to the penis. So that organ is squeezing on that tube and is making it impossible for you to pass urine. So they have to pass a tube into your penis to go into the bladder to help you remove the urine. And he has mentioned some symptoms because most men, I noticed, they have blood in their urine, and because they have blood in their urine, they think that it is STI. They have sexual transmitted infection. So they are going to take antibiotics upon antibiotics. Meanwhile, it is prostate cancer that is going on. So what age that a man will start having symptoms? That was the question.
Okay. So in terms of the age, symptoms comes anytime. The important thing is to keep an eye on the symptoms. It doesn't, I won't say there's an age limit to it or where you put an age limit, but usually around the age of 40, 50, 60, when you're getting to that age, you have to be more vigilant. At age 65, definitely things go pear-shaped sometimes because, that's the age where a lot of things start happening. But in terms of the prostate, once you are from 40 years and above, you need to be more vigilant than when you are still younger, because at that time the prostate size becomes quite it's getting bigger and bigger. And so the symptoms is anytime everybody needs to be vigilant. They're not normal, so because they're not normal symptoms. Whenever you have them, regardless of the age, you need to get somebody to have a look. You understand? Even if you are, God forbid, if you're 20 and you have these symptoms, they're not normal. A lot of the time you'll be infection, but it still needs to be looked into. And then if you examine and then you feel when people are examining and they feel there's a large prostate, then it needs to we have to have a look further and then look beyond. So it depends on what you're presenting with symptoms, then it will lead doctors to the next thing to do. So age, there's no limits or there's no cutoff, I would say. But more after 40 years, then you have to be more vigilant.
Why do the men not then seek what do you think is the cause that most of our men, especially in Africa, are dying from even urine retention? I'll give you an example. Very recently, it was a very close relation of mine. He was in some prayer house. He was unable to wee, and he was told that it is all orchestrated by the spirit. He was demonized. So he was there. He wasn't able to wee. His legs were swollen. He was very unwell. Fortunately, unfortunately for him, somebody went there and they got him out and they begged the family, let's take him to the hospital. I hear that they took almost 4 liters of urine off his bladder because he was in retention for almost a week. And he was at the verge of dying. His kidneys have collapsed. But by the time they drained the urine and they were giving him rehydration and stuff, by God's grace, he's better. He doesn't need dialysis. So what can you say to especially our men? Because most of them do not understand the symptoms. So I would like you to really talk more about it and the need for them to seek medical help.
Okay, so thank you. Now, the thing is, there's a cultural issue that we need to deal with. Cultural, religious, and even education. A lot of men, obviously, because of the way the symptom is, if you're talking about somebody going to the toilet all the time, frequency, they're feeling like, is there an infection? So we sort of, we won't go to see the doctor because you think, could it be an infection? And they go, because of the opportunity, they can go and buy Ampiclox and buy all sort of things. They keep buying all sort of antibiotics. They could go to the counter and buy all these things without prescription. They have access to it. So once they start treating themselves, and then they present when things are quite, bad, when they can't actually solve things themselves. And then again, in terms of the culture, a lot of the people, obviously, there's a diverse, you look at the diverse social level here, socioeconomic level. People who are the lower cadre of the, of the ladder, they do not have, either they're not educated enough, or the level of reasoning amongst themselves is different. So things happen, you're being bewitched. You understand? So then we need to deal with it from that angle. And the way they start doing things, all sort of funny things, until things are quite bad. And what will happen in this situation is, because of the position of the prostate, if you have this chunky thing sitting at the neck of the bladder, then the bladder grows. I mean, there will be retention in the bladder, and then you have dilated bladder, which it could lead to, there will be backflow into the kidney, and then it will have back effect on the kidney, because the waste that we're supposed to push out, we're not pushing it out. So it will hit the kidney, and then they might pack up with kidney failure, which if this is being dealt with early enough, it might not be the situation. So, and then I believe sometimes people believe any time that things like this happen, or most times when these things happen, depending on the group of people you're dealing with, they might be thinking, it is of spiritual attack, and then we'll go and attack you from the spiritual end, praying and not going to see the doctor. I always say this: it's good to pray, but it's good to pray and be sensible. You understand? Thank God for doctors. Doctors, even part of the apostle, Christ apostle, was a doctor. So was a physician. So we need to know that it's not something that is just starting now. We would just thank God for the opportunity that doctors are there to also help. So while we're dealing with it from the spiritual aspect, also let's be proactive in getting the doctors to have a look and then advise us in the right way. So that the answer to that question is multifaceted. You can have all these things going on together, and because of that, people don't come up, and then until it's too late before they're coming out to see the doctors.
What about the complications of because I know a lot of men in our villages, and some of them, their daughters are even like really concerned, or their sons or their relative, but they don't understand that this is prostate cancer. So this man keeps saying, they said, I have so many stories that my father has been having back pains for 2 years. He can't even walk anymore. Back pain. But this is always, most times in the villages, this is what the elderly men are complaining about. What can you say? Because this is like a sensitization to our children, like me and you, who have elderly parents.
Okay, so now back pain. It's not only back pain, but let me throw some light at the back pain. Back pain in elderly is very, very tricky. We have to be extremely careful, because back pain, there's what they call simple back pain, and back pain can be complicated. So simple back pain happens when you pull your back. You're pulling something, you're lifting something, then you pull your back. It's simple. There's nothing else. But a lot of the time in elderly people, you have to look very closely. Prostate cancer, the cancer itself, when it spreads to the bone, okay? And it will start with the bone around the area. So if you look at that picture that was shown earlier on, the bone that is close to that area is either your backbone or your pelvic bone. So this cancer will spread to that area. And the pain will start when it gets to the bone, because anything that hit the bone will cause pain around the bone. So it could be just simple back pain, getting worse. That's why I said, if you have anybody complaining of back pain, it's lasted 1 month, it's going to 6 weeks, do not wait. See your doctor, because that is not right. If you look at this picture now, you see where that red thing or what color is it now? Is it orange or whatever color is sitting? is sitting around the pelvic region. So that area, the things bones there are the bone of your backbone or the bone of your pelvis. So people can have pain around that area because that's the first place that this thing will spread to. And then once an elderly person complains of back pain, please let them see a doctor. Let them examine them very well. Let them do the right investigations because it could not even be prostate cancer. There are other things that can cause problem around the back that an elderly person will just tell you. For instance, there are vessels around that area. There's a big artery that goes along the track, very close to this organ in the pelvic area as well. If somebody has a big, an enlarged artery, which supply blood to the back there, they might come home and say, oh, we got back pain. And you start from there. And before you know it, they can burst this big artery. And that can cause catastrophic, situation where people collapse immediately and die. So it's not back pain in elderly. It's not something that I take seriously. It's something that I take seriously. I don't take it lightly.
Just be buying your father paracetamol. Just be buying him paracetamol. No, that's what the doctor is saying. It's not something to take lightly.
Yes, it could be. It could be even be something else because, for instance, bowel issue. People say, oh, he's constipated, is this and that. And then they keep them in the house and then wait until it's too late. It could be bowel cancer or things like that you're even dealing with as well. So in elderly, when they present with back pain or they're telling you about back pain, it's gone for a week, 2 weeks, let them go and see somebody before it gets too late. Because by the time you're getting to 4 weeks, 6 weeks, it's getting worse and worse and worse and worse. And that needs to be looked into. So have I answered your question?
Yeah, I have one more. What are the major problems with the prostate in a man? What are the three major things, or what are the major things that a man should look out for?
Okay, so there are 3 conditions, if that's what you're asking for. So majorly, people can have benign prostatic enlargement, which I tried to explain earlier on. There could be prostatic cancer, which is the cancer of the prostate itself. The other thing that can happen is what they call prostatitis. Okay, you have acute or chronic prostatitis, which is just an inflammation or infection of the prostate gland. So this, interestingly, the symptoms of all these 3, they're very, very close. They're just similar. It's the same symptoms. The only thing is the treatment or management of them is different. For benign prostatic enlargement, for instance, a lot of the time people will have to, like I said, you can have medicines to help. You might do nothing because it might not be serious. Then you might need to have medicines. Some people might need to have surgery. The surgery, there are various types of surgery that can be done, So there could be one that you just remove the prostate itself. Usually that's not usually done when you cut open the abdomen and then you take out the prostate completely. So that's what we used to do in those days. But now it's not something that is routinely done now. I think that we now use what they call, a kind of transurethral treatment, whereby we cut part of the prostate using a specialized tool to cut parts of the prostate in the middle to create a pathway that will then free the urethra where it's being compressed to relieve the symptoms. And there are 2 types there. There's one that's, the whole middle part is actually cut out completely to create that, to make that free. There's one that that middle part is lifted. The middle part of the prostate is lifted a little bit to relieve the symptoms. The one that you lift the part of the prostate is, I think, people tend to key into that more because there are some consequences to some of these treatments. When you have this operation, depending on the one that you have, for example, if the middle of the prostate is cut, and then there's a space there, when the place heals and this individual then start engaging and becoming sexually active again, men don't like the decision that happened then, which tend to happen often, and that's a retrograde ejaculation where they have dry ejaculation. And some men sort of find that a bit weird, and that's why the lifting of that prostate, the one that they lift the prostate, people tend to key into it. But you can actually, if you have these symptoms and you get to this stage, you have to discuss with your doctor They can tell you all the options that is available, and then that can be, and then you have an informed decision, and then you take a decision with them on which way you want to go. But for prostate cancer, usually they do, there are treatments in terms of the tablets as well, or tablet injection depending, and then after that there is usually need for you to have an operation. This operation is called it's a radical operation where you remove the whole of the prostate completely. There are consequences to it as well. Part of it is, impotence and things like that can then be a situation.
I think, Dr. Femi, that has been a big problem for men. I know a lot of men that even from last year, they've contacted me about that issue because they've asked them, you need to get a radical prostatectomy. They have to take everything out. And their problem is always the problem of impotence. What if I can't, but I won't be able to I mean, they've told me about this impotence. Do you really think I should go ahead with it? And I think there is that fear. But what do you advise them if a man comes to you and say, look, I have prostate cancer, they're going to take my prostate out, but the doctor have told me that I might have a chance of being impotent. So, doctor, what do you advise me? And as a man, like, what would you say to them?
I mean, sometimes we tread between the deep blue sea and the devil. And then there's a decision that we have to take. And that's why we need to have all the information. And obviously, I can think of a decision I'm going to take as an adult, but the decision lies on the individual when you look at the consequences of your action. Because if you have a prostate cancer, especially if it's an aggressive one, aggressive prostate cancer, they're quite really bad. The whole thing happens so drastic. If it's aggressive and it's being seen that, this operation can help, of course, we have to deal with it between the two, whether you want to look at, the issue around the erectile dysfunction, or you want to go ahead. So I know, I mean, this we have to discuss in detail. If I have such patients, what I probably do is discuss more with the urologist for options. In terms of the options, this is my own opinion now, feel that maybe some of the medications that we have might help, but the problem with the medication is even the medication can be a predisposing, issue to either other cancer or even the prostate cancer on its own. But it's never an easy situation. This has to be discussed extensively, and we need to bring other agencies in to discuss with them and see whether for this particular person, whether there are ways we can just help with that symptoms.
Can I say what I think?
Yes, please.
Okay. I think that men should discuss more with their family, especially their wives and their partners, when they are faced with this sort of situations, and not hide it, because it will make it more easy for them to take that decision when they are supported by their partner. Some men hide and hide and hide, and it's a lot for them to decide, what will my wife say? What will my wife do? How will my wife react if I become impotent? My wife will start going outside, but she might not if you put her in the picture from day one and she understands what you're going through from day one. Yes, it's going to be hard for her, but if he's saying to you, look, we have to do this together. He said, don't worry, I'm doing this with you. We have to do this. It makes it easier for the man to take that decision. So if such men, they come to me, I always say to them, look, you need to sit down with your partner and have a discussion, because this has to do with your sexual life as a partner, in a relationship. You cannot take this decision alone. A lot of men have caused problems for themselves because they take these decisions alone. They come home with complications. Then they are buying all these sildenafil, all these things to just complications upon complications, when they would have discussed this issue from day one with their family. If they've got grown-up children, they can bring them into the discussion, and it will make it easier. But in an African setting, Dr. Femi, we are not used to this type of communication. I don't know why.
Well, that's where the cultural things happen. And obviously, the culture is rich, but at the same time, it's got its own downside. And I think you're right. So family is part of the agency that needs to be brought into the discussion. And also look outside the box and see whether there are ways by which this individual can also be supported. But the decision, again, is going to be the man to take the decision. But these are other things that he needs to look. There are options there, these are the options. And then eventually, he will still have to take his own decision, whether he wants to go ahead and do it, or whether he wants to, stay within the blue sea. So that's yeah, you're absolutely right there, and I agree with you.
Somebody's asking, can you tell me where I can do blood tests for prostate cancer in Nigeria? I think you already explained this. Please, can you explain it to this Ojo Alex Rotimi again? Please, can you tell me where I can do blood tests? Do you do blood tests for cancer? I don't know. You need to answer the question.
The PSA is a blood test. So he can have PSA done as long as, I hope he heard what I said earlier. Like once it's an informed decision, if he feels that he wants to have it done, yes, he can have it done. There are a lot of laboratories that can do it, in Nigeria. So it's not a big thing to do. It's just you making up your mind that you really want to do it. And if you think you still want to do it and you want to be signposted, you can leave a comment later. We'll signpost you to the right direction.
Okay, thank you very much, Dr. Femi, for today. I think you have done it. You've said everything. The things you've said can actually save a lot of men. I'll just give you the next 2 minutes. I know Dr. Femi lives in the UK, but he's in Nigeria now, and he's been there for over maybe 6 months. He's doing lots of work also around cancer awareness, but this time not prostate, but breast cancer. So can you tell us about what you're doing, your programs that you're doing in Nigeria?
All right, thank you. So we've been doing awareness around non-communicable diseases, including prostate cancer. But majorly, we've been working with partners to help communities. Our target is to help to reduce the incidence of breast cancer by I think 10% of incidents we're working on for this year. So we've been going through various communities across Nigeria, to be honest. So what we do is we have a team. We go to do cervical screening, and then we'd also do cryotherapy treatment for cervix, and then we do breast screening using we don't use just hands to do the breast screening. We also use a scanner, the breast eye scanner, to do our screening. So when we go out, we do this too, and we get partners to come and talk to people around, mental health among the youth. And we also do things like bowel cancer screening. And, we just make it in a way that we take this thing to the community, because we know people are not doing it. We know there are a lot of people dying from all these things, and this shouldn't be the situation. So, for instance, breast and cervical cancer, if we look at the rate of people dying in Nigeria, where the population is, the number of people developing the thing is lower compared to developed country, the rate is so high. If we look at the next 10 people diagnosed, we'll follow them for 5 years, only 1 or 2 will be alive in Nigeria. You come to developed countries, UK, America, Japan, if you do the same thing, you discover that about 8 or 9 will still be alive after 5 years. So we've asked the question why, and we realize that's because we don't do screening. There's no formal screening in Nigeria. So what we're doing now is putting a structure together to see how we can work with other, partners and people of interest to see if we can create pathways whereby people then get screened at a very affordable cost, because we know that the issue is around what is the gold standard that we need to be using. People can't afford it. So people can't afford it and they die. They come back. By the time they come in to see the doctor, it's too late. So if we screen, we're picking quite people. We're picking people at a very early stage. For instance, our last outing, I think we picked about 15 people. In total, since I've been around.
15 women with breast cancer in your last screening. You
Yes.
picked up to 15 women with breast cancer.
Yes, out of about yes, we did about 150 people. So we picked 15. So the 15, what happens is when we pick these people, it's screening, we screen them positive. Then we send them to a center where they can have further assessment, and then they will have confirmatory tests. And, you know, we've had quite a lot of people being positive. In fact, one thing I want to solicit here is if there are NGOs or people who are into supporting people with diagnosis, we really need your help, because we have people who are positive, they can't pay, and these guys are going to die. We literally have to be using our own resources to support them in terms of, you know, helping them. We have somebody as young as 20 years old, confirmed, has everything confirmed, but needs treatment, but can't afford, you know. So if we have people that can support us in this course, we'll really appreciate it. So
Thank
yeah, that's
you very much. You're doing a good job, Dr. Femi. Thank you. I think I'm always of your school of thought.
Yes, one thing is for people that want to follow us. Okay, actually, if you want to follow me, you can. If you're on Instagram, you can look out for me on Dr. Femi Ogunremi. So my Instagram handle is Dr. Femi Ogunremi, which is Dr. Femi Ogunremi, and then you can also check us on at breast cancer scanner. So we have those two links that you can actually link us up there, and then you can follow us. You can see some of the things that we're doing. If you look on my Facebook page as well, you will see quite a lot of things that we're doing. So, and if you want to connect, you can connect with me there, and then we can take it from there.
Thank you so much. You're doing lots of good work back home. I think in what we really need as Africans is education, sensitization. And I mean, there's the financial aspect. And I think yesterday I even said to somebody, I said, I prefer prevention than cure, because
Yes.
prevention is far cheaper than cure. If somebody, I know sometimes you cannot really prevent breast cancer happening. It happens anyway, but there are so many other things like diabetes, hypertension, which you can prevent having a stroke or a heart attack because you are aware. And because you're educating women on breast cancer, they can actually detect early, and it's cheaper to treat early than to treat complicated advanced breast cancer.
Sure.
So thank you so much. Dr. Femi is on Facebook, he's on Instagram. He has an instrument they use for screening, and he's all over Nigeria. If you have an organization, he can come in and train your staff. He can come in and do seminars and train your staff and show them how to use the breast banner.
Screen them as well. We can screen them as well.
Yeah, so he's doing loads. If you're interested, just contact him. And also, you need to do more for the men on prostate cancer, awareness, education. So incorporate that to your program, because the men also need you, not just the women.
I know. We're doing that. We're doing our best as well. Thank you.
Okay, thank you, everybody, for joining. Thank you, Dr. Femi. Thank you so much for coming. And men, please take care of your health. Involve your family, involve your wife if you're married in your treatment, in your whatever you're going to, so that they will give you the necessary support. And if you have any of these symptoms, you can drop us a message. I know you guys are so private. You can drop Dr. Femi an inbox, or you can drop me an inbox. Discuss your symptoms, and we are going to get you, support you on getting help, and signpost you to where you can get help. Thank you so much, everybody. Thank you, Dr. Femi, for coming. God bless you all. Have a lovely weekend. Bye for now.